Hi everyone, welcome back to the Dr. Sia channel. In this video here today, which is the second session in a series of 5 videos of a patient who comes in and blames herself for being abused in her relationship. If you haven't seen the first video, I'll link it up there or there somewhere. I don't exactly know which side it is, but it's going to be up there somewhere. And watch that one first before you watch this one. And so no further spoilers. I'm not going to tell you really what happens. Let's get started, and then make sure you stay put for the wrap up at the end where I talk about what I saw, what I did, why I did, what I could have done better, and so on and so forth. Let's get started. Natasha, where would you like to start today?
I'm still experiencing anxiety, and from last session, I still believe that it's my fault.
Yeah. Well, can you just help recap that for me a bit so that I remember what it is that we're talking about? I do remember, but that we can sort of make sure that we both know what we're talking about.
Well, I get anxious a lot, and more so when I know my husband's coming home, because I don't know what to expect from him, and I often overlook really simple things that he gets upset and angry about.
That's right. And then he gets violent.
And then he gets violent.
And then you get anxious.
I get anxious. And I know that the reason why I get anxious is because it's my fault, because I've done something wrong.
I understand. That's right. So your husband comes home, he gets violent towards you, and you have the idea, the thought, it's all my fault, and then you get anxious. Or is it that you get anxious first and then you have the idea that it's your fault so that that reduces the anxiety?
I get anxious when he gets violent. I get anxious until I really reflect, and I have a good look at the situation and see where I've gone wrong.
Sure.
And that's when I'm able to calm myself down, when I'm able to acknowledge my own failings.
Yeah. Okay. And we were also talking about, what do you think causes that anxiety for you, that then your self-blame reduces the anxiety, right? The self-blame helps you reduce the anxiety. You knowing that it's your fault helps you feel less anxious once you acknowledge your blame.
Yeah, well, it is my fault. It's just the feeling I can't shake it until I really look at what I've done wrong.
Yeah.
And I acknowledge it. That's the only time the feeling settles down and the anxiety goes away.
That's right. Yeah, I can see that you very strongly believe that it's your fault. And when you do very strongly believe that it's your fault, your anxiety goes down about that.
Yes.
And what do you think causes that anxiety to begin with?
I don't know. My feeling of failure,
Yeah.
I don't know.
Yeah, it's hard. It's very hard. Here right now, are you feeling anxious with me? Are you experiencing that anxiety in your body right now?
Yes.
Okay. How do you experience it in your body right now?
It's not like I'm angry or anything. It's not like I want to punch my husband in the face or choke him. It's not like that or anything like that. It's not like that at all. It's just, I just feel anxious. I just feel like my body's just so tense.
Right. Yeah, that's that tension there, that anxiety. And it's not like when your husband is beating you up that you would want to be angry with him.
No, I'm not angry at him.
No.
No,
that's right.
I'm not angry at him.
Yeah. And your anxiety that you're feeling. Yeah. So what do you think is causing that here right now?
Just being here.
Just being here.
Just having, just not being able to figure out why I keep getting things wrong.
Yeah. And then you not being angry at him.
I'm not angry at him.
No, I understand. Yeah. And how do you feel underneath that anxiety that you have in your body? So where is it sort of in the chest? Is it there?
Just here, it's
Just
there. It's just hot.
Yeah.
It's just heated.
Yeah.
It's just,
Yeah.
I can feel it. It's just burning.
Yeah, burning. And does it sort of want to go up or down?
It's like I can't draw a deep breath. It's like there's like something there.
And when you focus in on that feeling, that burning feeling, what comes to mind?
I don't want to. I'm not angry.
No.
I'm not angry at anyone.
No.
I'm not. It's my fault.
Yeah.
It's me.
Yeah.
It's me who's doing the wrong thing.
Sure. And when you focus in on that feeling, the first thing that comes to mind is that you say to me is that you're not angry.
Because I'm not angry.
I understand. When you focus in on that feeling, what image comes to mind for you? Before you sort of then think, I'm not angry. What?
Hate.
Yeah.
Just like a rage.
Okay. Yeah. All right. So let's just pause it down there and see if we can understand what just happened. You say that when you focus in on that feeling, there's some rage there. Yeah?
Just heat.
Heat. Yeah, some heat and some rage. Did you hear yourself saying that?
But it's not anger or anything.
No.
It's not.
No.
I don't want to hurt anyone.
No, I understand. Of course, you don't want to hurt anybody. We understand that. We wouldn't be doing this work if we thought that you're going to go out and hurt somebody. We know that. You're not going to hurt anybody. We understand that. But then, do you remember saying that you had some rage just then?
I don't have rage or I don't have anger.
No. Okay. All right. But there's some hot feeling. There's some heat. There's some heat there. And that heat is related to your anxiety. Is that right?
Yes, it's like it's bringing it up. It's
I understand. Yeah, so there's some heat in your body.
Yes.
And then you get anxious on top of that.
Yes.
And then when you tell yourself, and then when you start knowing that it's your fault,
yes,
the anxiety goes down and the heat goes down.
And it settles.
And then you settle.
I just need to reflect and see what I've been doing wrong. And
okay.
That's it.
Yeah. That makes a lot of sense, though. Can we look at that just one more time, just to understand that together? Your husband comes home. You haven't hung out the towels. For example, that's just an example. He starts getting angry and violent. He hits you. You get this heat inside.
Yes.
Yeah. This volcano.
It's an eruption.
An eruption. The anxiety sits on top of that.
Yes.
And that gets extremely uncomfortable. And when you then acknowledge that it was your fault to begin with, the anxiety goes down.
And the eruption
stops.
And
the eruption stops. Okay.
Yes.
Yeah. Can you help summarize that for me? Is that
so it's almost like as if I start to erupt and feel anxious. There's heat. It just gets brought on. I get hurt. I just start to, I just feel so angry and anxious and pissed off. And just the anxiety is too much and it's raising. And then I start to realize what the truth is. And the truth is that I'm causing this because I'm at fault for this.
I understand.
And because I'm at fault for this, I have to acknowledge what I've done wrong, what set my husband off, what's caused this situation, and then it just settles. It's so much better. It's just that's the thing. So that's how I take care of myself.
Right. Yeah. That's what you perceive. That in your idea, that's what self-care is.
That's it. That's bringing myself leveling down.
Yeah, leveling down. I understand. Your husband comes home. He gets violent. You get angry when he's violent with you, and then you feel anxious.
I feel anxious.
You feel anxious, but not angry.
I'm not angry.
No.
I don't want to hurt him.
Yeah, of course. No, I understand. And then, okay, so he comes home, gets violent with you, you get anxious, and this heat builds up, and then you tell yourself, and then you start knowing that it's your own fault, and you calm down.
Yes, that's right.
That's right.
That's it.
Do you think between our session now and our next, you can sort of, next time you have this heat, focus in on it a little bit, understand it a little bit better, just see what it is and see what you would call it.
Give it a name.
Give it a name, and then see if between now and our next session we can work a little bit more on this heat that causes your anxiety.
Yeah.
Yeah?
Yeah.
And maybe then we can also have a look at this self-blame and see how it's related to the heat and the anxiety.
Okay.
Do you think that would be useful?
Yeah, we can do that. We can look at that.
Well, let's do that. All right, so it's not surprising that Natasha comes in again and says that she's still blaming herself. We can't expect that a person's self-blame for being abused is going to go away in just one session. I mean, maybe some people can achieve that, but I certainly couldn't. But here with Natasha and I, what we're basically looking at is we start going into self-blame, and as we sort of push in on that and the anxiety that is related to, what happens is she starts getting angry. And if you notice, what she does is she doesn't say, I'm getting angry. She actually negates. So it's a defense mechanism where we can almost in a way express what we have going on, but at the same time sort of make sure that it goes away. So she said, I'm not angry. It's not like I want to punch him in the face or anything like that. Now, I'm not the one who said that she's angry. But really what happens is over and over, she keeps saying, I'm not angry. I don't want to punch him in the face. And then when I ask her at some point, what do you notice happens inside? She says, well, actually rage. And then when I say, what did you just say there? She's like, what do you mean? And all of this is obviously different defense mechanisms. So there's the negation of just saying what basically goes on inside her, but then putting no basically in front of it so that it never was said. And then there's this idea of sort of denial where she says something and then she sort of, no, I didn't say that thing. And I get a sense that she is denying it a little bit because in the sense that what's happening is she seems like she can actually handle some pressure. If you see, she has some striated anxiety going. I know she says that she has some anxiety going in the middle area there, but I think it's more muscular tension as opposed to sort of midline tension. So she seems like she's quite really capable. What I never really figured out was whether she was denying consciously or whether it was unconscious denial. I think it was unconscious denial. And then another thing that we also see is that she's starting to become a little bit sort of regressive. I don't know if you've noticed that, but she's sort of, hunched down and like, oh, I'm so innocent and all that. And I think that all that is really to ward off that and potentially I would come at her and come after her anger and come after her rage and push in even further. So there is some projection there as well, that almost like I'm the one who wants to go in there and find all these things as opposed to she's the one who actually came to get her, to improve her life. So yeah, those are sort of the kind of things that we saw in this session. And so far, I think it's clunky work. I mean, when I look back at that video, I think it's a relatively accurate picture of what actually happened in real life. I think, yeah, it was clunky like that. It wasn't a really good session on my behalf. But you know what? That's one of the beautiful things about ISTDP is even when you have sort of a funky session and you're not really, you're not really on the top of your game and your patient might be harder than your skills or the things that are going on for them might be sort of, you might be outskilled basically by the problems. It's still a very good therapy. So even with that session, looking back at it, and even now many years later, I've trained a lot more since I had that session. I look back at that session and I think to myself, oh, well, a lot of mistakes, but still we got good results. So yeah, ISTDP is a very good therapy, but it's also a very forgiving therapy for anyone who's trying it out. So patients and therapists included. Anyway, I hope you enjoyed the video. I'll see you again for session 3 with Natasha, and I think I'll release these approximately just about like once every week or so, and there's going to be 5 sessions. So yeah, let me know what you think, and I'll see you again next time.